Welcome to ASA Live, broadcasting from On Aging 2021. I'm Peter Kaldes, CEO of the American Society on Aging, and today we have a fantastic guest, a gentleman who is not a stranger to many of our ASA members, definitely not a stranger to me, my good friend Tom Kamber. Tom, welcome to ASA Live.
Hi, and I'm thrilled to be here today, Peter. I feel like we should be in Times Square or something, but I guess we can't do that.
Well, you know, if we are airing live on Twitter and Facebook, and I think YouTube, as well as our conference platform right now. So maybe one of those might air it on a billboard. Maybe Twitter can do it.
If anybody out there is getting this on a billboard, please send us a screenshot.
Tom, listen, before we get into the meat of our conversation, I'm curious, how's the conference going for you? Are you enjoying it?
Yes, I am. It's been a lot of fun. It's just neat to see the range of topics, and I've been getting a lot of DM messages from people that are finding me through the conference system, which is kind of a neat thing. I guess I don't know if it's the first time we've ever done this, but it's the first time I participated in it. So I got a message from somebody in South Korea that reconnected with me yesterday, and so there's kind of a global framework to it, which I've been enjoying. And we did this great panel on digital divide issues and technology with people from Microsoft and CDW and Comcast were on, and it's just really been a great fruitful conversations. I always learn a lot more than I bring to the table each year, so that's, I guess, the ideal, right?
Well, I'm glad to hear that. You're absolutely right. I don't know if you know this, but this is the 61st conference for the ASA, and it's the first entire virtual one. So we're learning as you are, and I'm so glad that as an attendee, you actually have the ability to connect and network and do all that sort of behind the scenes, magic, relationship building stuff that people love to do at the conference. So I'm glad to hear you're doing that. Yeah,
it's definitely the digital format. Once you get used to it, it is kind of like that, what we used to do out in the hallway or the lobby at the hotel, right? And now we're doing it online, but it's working. It's working for me anyways.
That's great. Good. That's great to hear. So let's talk about you, Tom. Speaking of working, your work has changed a little bit, I hear, since January. I understand you're part of a new family. Do you want to share that with us?
We are. It's been about a year in the coming here. But we are extremely excited that in January, at the end of January, we announced that we have become a formal organizational affiliate of AARP. And that puts us alongside other AARP nonprofit affiliates like the AARP Foundation and Legal Counsel for the Elderly in Washington, D.C., and another affiliate that joined recently called Wish of a Lifetime that's based in Colorado. And it's a new model that they're using to kind of expand their organizational framework a bit to bring in nonprofits that they think have something to add to their program mix and a certain expertise or experience that they want to bring in and engage with without having to create from scratch. So from our perspective, it's a kind of a dream come true in a way. As a nonprofit, I can tell you more about that, but it's something that really advances what we're trying to do, and I think that they see us as a value add as well.
And do you think this changes anything with what OATS does?
Yes and no. I was on a session a couple of weeks ago where we were talking to Senior Planet members and talking about that intimacy that we have. So for those of you that are not as familiar with OATS, OATS is the nonprofit parent, and I was the founding executive director 16 years ago when I used to have hair. And we evolved over time to develop a program called Senior Planet, which is the main framework for all of our programs that face customers. And so the people that we serve are typically 60 and older, average age about 74. And so when we work with people in Senior Planet, many of them see us as kind of a lifeline to technology and to each other. They form these groups of about 10 or 15 around their classes or their programs, and it becomes very intimate. And so one of the questions people asked is, now that we have this affiliation with AARP, does that mean we're going to lose the opportunity to have those intimate connections with each other and with Senior Planet? And in fact, I emphatically said that will not change. That's not where we're going. The organization, OATS, is retaining our 501c3 tax exemption as a charitable organization. Our mission continues exactly the same as harnessing technology to change the way that we age. And our commitment to having world-class programs and outcomes for older people is identical, hasn't changed at all. In fact, it's even more emphatic now because it's freed us up to focus more strategically over time on creating really great programs instead of being so reactive to the funding cycles or the geographic differences where we have to kind of slot into different frameworks. We can back up a little bit and smooth out the growth plan so that we are national in scope and that we can make a difference across the country, but also across the calendar year, for example. So our work is already improving, I think, as an organization. We've been really working to increase that connection to the customer. But the thing that is changing, of course, is the scope. Every social impact person, maybe not every, but most social impact activists do think a lot about how you can get your scale to go bigger. How can you work with more people? How can you take this wonderful program that is working great for 100 people and help it work with 1,000 or 10,000? And the relationship with AARP, they have 53 state offices because they include Puerto Rico and Guam and the Virgin Islands. They have a huge national, advocacy and impact environment there. They even have a virtual community center now that's got classes, and we're delivering programming with them. We're having 500 people in some of the sessions. We had 10,000 people in one of the sessions last year. So that scope and scale is really coming together, and we're having to learn a lot of new skills around it. It's not simply just about the same thing but bigger, but we're having to retool and get better at different things. So it's pretty exciting.
Well, you talked about funding as well. In order to scale up, you need to continue, getting amazing sources of funding and wonderful partners. One of them that I know about is the Humana Foundation. And I know I want to get into that as well, and the project that you're working on with them, because I think there's an opportunity there for ASA members. But before we go there, let's talk a little bit about the Humana Foundation and your work with them.
Sure. Bruce Broussard is the CEO of Humana, and a few years back, he worked with the foundation and Walter Woods, who's the president of the foundation, to reanalyze what they were doing and move toward a more impact-focused philanthropic model. And what that, as a nonprofit, executive, that's always music to our ears, right? We're looking for grant makers that are really interested in saying, not getting in and micromanaging our business, but really getting in and saying, if I give you $100,000 or $1 million, what kind of outcomes can you measure? What kinds of change can you really forecast for that? And how can we help you be more strategic about leveraging our investment into your model to some kind of impact or scale there? And so they retooled their programs and they reduced the number of grants, but increased the amount of them. And we were very fortunate to get one of their first real impact grants focused on social isolation. And we took that program to San Antonio, and we did 2 years of collaborative work with them, launching the Senior Planet program in San Antonio, but zeroing in specifically on thinking about how every interaction with the OATS programs, whether you were learning how to use an iPad, or you were going online for the first time, or you were connecting to even online banking resources or something like that, everything was viewed through the lens of increasing people's social engagement. So we did that for about 2 years. We had very positive results. Some of our indicators went up by 30%. So we were getting these really great results, and then COVID hit. So instead of year 3 being just focused on, taking those results and catalyzing them into larger frameworks, we also had to kind of think about, what do we do where people are, I hate that word pivot. Everybody's always using the word pivot now. So let's just say change. But people are changing to use this digital format now. How can we take advantage of that to overcome isolation, to engage older people more successfully? And when they called us over the summer, they said, we're having an emergency fund we're putting together. What could we do to make a difference? And we have heard for years that a lot of seniors are not online, right? Everybody knows that. Everybody knows a lot of people over 60 that are having a hard time because they don't have internet at home. And all of these great things that we're doing together are in many cases contingent on people being able to access them with technology. So we said, let's go at that connectivity problem. Like that's the linchpin for so many other things. Like once we get people online, it unleashes all this value from the service sector and from the telemedicine environment and from places like OATS and AARP and ASA. And so, but how can we get at that better? So we asked them for a major investment. They did a $3 million grant to OATS, which is our largest ever private donation up to that point. And we were really thrilled with the commitment that they made. And the first stage in that has been to actually understand what the connectivity crisis looks like. So we spent the first few months putting together this report called Aging Connected, which we just released last month, and provides the first ever really comprehensive view into the problem of connectivity for older adults, what's going on, who's offline, and what we should do about it.
I would love to maybe just get some highlights of that report. I know there are some wonderful studies from Pew and others that basically state that about 45% or so of folks over 65 don't have access to broadband at home. And I'm wondering, what were your findings like?
Our findings were similar, although they were a little bit more precise, because what we did that nobody had done before is we just took an age cutoff. We said 65. Let's look at 65 and older and 65 and 64 and younger. And we asked one of the premier researchers in the country who specializes in this kind of research to just run all the data and find out how many people are online with wireline internet access at home, which is a good benchmark for broadband, and do it 18 to 64 and then 65 and older. We found that 42% of people over 65 do not have wireline access at home. And that's 15 points worse than the 18 to 64 group. So there's a big gap there. That's, when you're looking at social science analysis and research, a 15-point gap is a huge difference. And when you're talking about 4 out of every 10 people that you're trying to serve not being able to get access to this stuff, it's really a big deal. It translates into 21.8 million older adults in America. And when you look at the COVID numbers and you realize that 80% of the people who have died from COVID are over that age threshold, and you think about how if you take that group of people that went through this crisis and had the ultimate consequence here, that they had no internet access while they were grappling with what they went through, we've really failed that population. We failed everybody who is not online and made it much harder than it had to be. And in some cases, increased their risk because they had to go outside because they couldn't get services online. So they had to go to face-to-face, and that increased their risk of actually contracting the virus. So the big picture is we have a huge connectivity crisis among older people. There were a couple of other numbers. Should I go on?
Yeah, no, I mean, I think folks would find it really interesting.
Okay, a couple of things that we learned that were really interesting. First of all, up to that point, there was no national program to subsidize low-income older adults to get online. So it was only done through the only services and programs that existed were these kind of negotiated deals and voluntary programs that were set up by the telecommunications companies. And we analyzed those and found that most of them were not serving significant numbers of older people. In fact, some of them that don't serve anybody. They don't have anything for seniors. Some of them have programs that serve about 2% of the older adult population. But the biggest of the programs, which is run by Comcast, turns out to be a different kettle of fish there. About 53% of older adults in America, if they live in Comcast environments, are eligible for a program called Internet Essentials. And so that was kind of a big, wake up call. Like, why is everybody not participating in that? It's $9.95 per month. So it's a pretty affordable access. There's some restrictions in terms of the speeds and whether or not you have a debt to Comcast and things like that. But by and large, it's a pretty interesting opportunity for people. So we flagged that as an area. We found that of the people who are offline, about 2/3 of them would qualify for a low-cost subsidy. And about 1/3 of them are actually higher income. And you might put them into the category of sort of almost, I would hate to say voluntary non-participants, but people for whom money may not be the principal determinant, but rather we have to talk about the value proposition, the training, and promoting a culture of use amongst older people, which is really essential at this point. So, you can divide it into 2/3 and 1/3 there. And then the last thing that we found that was really, really interesting and I think important is the offline population is predominantly overlapping with all of these categories that relate to equity and social justice in America. So you're about 3 times less likely to be online if you're African American and older. If you're Hispanic, you're 4 times less likely to be online. If you're living alone, you're twice as likely not to be online. If you are in a rural area, you're much less likely to be online. So these different elements, people that are in poor health are much less likely to be online at home. So if we get people online, there's actually a kind of a distributive effect in terms of addressing social equity issues. And so for people who are looking at that right now, this is a priority, not just because we want people to be able to access their email, or telemedicine if you're talking about something more vital, but if we're trying to make a more inclusive and broadly based society where people are participating in the benefits that we are trying to distribute, digital access is really one of the central issues. And that's one of the things we found.
Well, I think your research is really important. I'll tell you this, later this week, we'll be sharing some additional details about how ASA's own new policy and advocacy agenda is going to include a lot of the things that you just talked about, like bridging the digital divide, like tackling health disparities and creating greater access to healthcare. And I think technology can actually help with all of that. So let's talk about what you will do now with that research. What's next?
So the next steps are, a couple of things are happening. First of all, while all of this was unfolding, the federal government created the first ever subsidy, publicly funded subsidy for low-income people to get online. It's called the Emergency Broadband Benefit. They're currently finalizing the regulations and the engagement for that. And so you're going to be hearing a lot about that in the next month. And we will be keeping ASA right up to date with what we're learning. But within the next 60 days, that's going to go live. And so people who are lower income all over America can get a $50 a month internet subsidy through any of the providers that are participating. Most of the big ones will be. And we're going to be running a campaign to take advantage of that because it's available to everybody across the age spectrum as long as they're lower income. We want to prioritize older adults who are currently not online and try to create this as an opportunity to get people to get that first ever taste of the internet, because it's a free or low cost opportunity for them to try it out, and they don't have to pay full freight. So that's the first priority. And then secondly, we're going to be working with ARP and with ASA and others to create sort of this national effort to look for all the different resources that are available where people can bring seniors online. We're calling it Aging Connected, and people can go to agingconnected.org right now. You can read the report that we wrote, and you can also put in zip codes, and it will bring up where different kinds of low-cost programs are available for people that are vulnerable or may not be able to afford retail. So we're going to be creating a series of materials, packaging together training resources for people, packaging content so that when people do go online, they have relevant content as older adult users, and really making the most of this effort. This is going to go right through 2022, but of course, everything we can do early on has a bigger magnified benefit. So we're really prioritizing it right now.
Absolutely. I couldn't agree with you more. I'm delighted that you're leading this initiative. I'm delighted that OATS is driving this change. ASA is there to help in any way, shape, or form. Many of our members, as you know, are organizations, community-based organizations that had to sort of figure it out on their own, right? At the height of the pandemic, had to figure out how to deliver services to the unconnected. And I'm proud of many of our members. They've figured it out. Many of them relied on OATS and some other resources that are out there. But anything we can do, Tom, at ASA to help sign up and take advantage of the subsidy, just let us know. We're happy to help.
Well, we'll be coming back to you. We actually were talking about it in a meeting this morning, and half of the meeting was about ASA and about what we can do because ASA has just this really kind of robust and diverse group of members out there who have deep roots into various different communities. And so from our perspective, we really need to work closely with you to package some of these resources so that they're really relevant and usable for people. So, 2021 is our big priority year for that. And the fact that you guys are going through this kind of transformation also to become really digitally sophisticated and focused on equity, to us really puts us in the same lane on this stuff.
Great. Well, Tom Kamber, Executive Director of OATS, thank you so much for joining me on ASA Live, and I hope you continue to enjoy On Aging 2021.
I look forward to it. Thank you so much for having me today.